Hello, my name is Dr. Soyini Hawkins, and I am a minimally invasive gynecological surgeon in Peachtree Corners, Georgia, just right outside of Atlanta. And I treat women with endometriosis as well as other pelvic pain conditions and dysfunctions of menstruation and things that cause it, like fibroids and polyps and so forth. And I am an endo warrior. So I think that women of color should know that endometriosis sees no color. Okay, endometriosis sees no culture or ethnicity. It's not specific just to one type of woman. It's not specific to one type of sexuality of a woman. Endometriosis doesn't discriminate. So when we look at textbooks and sometimes when we talk to physicians about our pelvic pain and discomforts, endometriosis doesn't pop to their mind automatically because we don't look like a textbook definition of what endometriosis is. Women of color should know that we too have pain. We too could be endometriosis sufferers as well as endometriosis survivors and endometriosis warriors. So the best treatment for endometriosis really depends on the woman. It depends on her symptoms and it depends on her goals. What is she looking to seek? Is it fertility? Is she looking just to seek relief of her pain? Is her anatomy distorted? Is something wrong with her fallopian tubes or her ovaries? Does she have adhesive disease? So the treatment can vary anywhere from medication all the way to surgical intervention, and surgery being excisional surgery. In my practice, do what's called excisional surgery for endometriosis, where I actually cut out and remove the lesions, which I think works best for patients and has been highly studied to actually get rid of it. It's like cutting out cancer, right? But again, not everybody needs surgery, nor is everybody a great candidate for surgery. So it really depends on the patient. So the regular OBGYN doctor that might see the patient first, or even a family medicine doctor or primary care doctor that might see the patient first. Wherever those complaints are coming in from the physicians, we owe it to our patients to treat them as individuals, right? Racial inequality basically says that we are making these preconceived conclusions about our patients and what their symptoms might actually equate to even before we do the evaluation. So I'm a strong believer in truly being diagnostic, always in a very, conscious and safety and equitably way, meaning that every patient gets the same type of care and attention and like problem solving as the other. So no matter what their ethnicity is, their race, no matter what the books might say about what the proportion is that might suffer from this, that are of a certain type of makeup, I think the investigation should be across the board, because honestly, these are things you don't want to miss in your patient population. We care too much to miss them. So every patient that comes in with pain should receive an exam and should receive a diagnostic ultrasound. It's a simple, easy test. Most of doctors have it in their office or can easily send their patients out for it, just to make sure, one, we're ruling out other things, but also not forgetting to rule in what might be there and causing a problem. So across the board, every patient should be treated as an individual, and every patient should receive the same type of attention. When you do it like that, it's very, very hard to let those racial biases in. So the standard textbook, let's start over there. What does the standard textbook look? When I was trained, I was taught that endometriosis patient very typically looks like a young, slim, Caucasian woman. She might look like an athlete, very healthy looking, and has pain with every cycle since she started her cycle. Endometriosis doesn't always present like that. Endometriosis, again, has no weight restriction, has no height restriction, has no race restriction. It also doesn't always have that history that it's been pain forever. What about that endometriosis patient that has developed pain because of something else, has developed pain because of fibroids? I see endometriosis in the pelvis of probably 40% of my fibroid sufferers. And if you think about just the mechanics of how fibroid work, some of that backflow of the menstrual lining that might implant into the pelvis is why those patients might get endometriosis later in their life. So endometriosis doesn't always fit those check marks, and certainly could fit one and not another. There could be a patient that has pain just with their intercourse, or a patient that has non-menstrual pelvic pain from the jump and never just suffered from pain with their cycle. So it's not always the textbook definition. We have to kind of think out of the box when it comes to diagnosing a lot of these women. So my diagnosis was happenstance, just like I was describing that fibroid patient that finds out they have endometriosis when they have surgery. That was my story. So I actually don't think I had endometriosis as a young woman. I was diagnosed surgically, never went to the doctor complaining of pain that I thought was specific to endometriosis, never Googled about it. I had fibroids, and when I got discovered that I had fibroids, I was late for diagnosis of that as well. My fibroids were already almost 18 centimeters by the time I was diagnosed. I had no idea they were there. I'd also been on birth control pretty much most of my life to control my cycle, and control it in a way that it just didn't inhibit my schooling. It didn't slow down my day. It didn't slow down my month. So I may have been covering it up or in a sense, my fibroids and my endometriosis. But once the heavy bleeding started and the pain started, again, because that endometriosis was something so palpable, something you could easily see on the ultrasound, and endometriosis wasn't, we all turned our attention towards the fibroids, and it was a red herring. It was completely missed, my endo, and surgically, by the time I had surgery and had to have a open abdominal myomectomy, that I was found to have stage 4 endometriosis. Thank God my doctor was able to clean me up really well. He was able to get out as much endometriosis as he possibly could. And granted, I did get my surgery done at an endometriosis center of excellence. And that is also where I did my training. After I had my surgery and graduated, I went back to him and asked him to teach me everything he knew, because from that surgery, not only do I have a normal uterus, 10 years later, my fibroids haven't grown back. My pain from my endometriosis never came back. I also stayed on top of it and suppressed my cycle for the rest of the time after that. And I also had 2 lovely baby boys. So I was able to achieve pregnancy shortly thereafter as well. So my journey in that typical, like, did I go to a lot of doctors? Did I research? Did I know I had endo before somebody else told me? Was I misdiagnosed? I was missed in the diagnosis because I was diagnosed late. However, I wouldn't say that I actually even gave anyone an opportunity to find endometriosis. Now, I feel a little differently about my fibroids. They were big. Someone should have felt them before they got to that size. But nevertheless, in timing, I think everything worked out because I got the treatment that I needed from the doctor that I needed, and it worked out in my favor to accomplish the goals that I wanted for my health and my fertility. So my journey is a little bit different than, unfortunately, most women. They have to go through 3 or 4 or 5 doctors before anyone's willing to listen, or they're not empowered to describe their pain the way that it will actually, come across as, okay, this is inhibiting their life. This is actually impacting their daily living. They're going to the doctor and saying, oh, I have a little pain, where in actuality it's a lot of pain and it's stopping them from going to work. So we're missing that. And I encourage, especially Black women, to feel empowered enough to advocate for themselves when they do go to the doctor. Empowered enough to take notes and write down their symptoms, make it clear, so when they go, they can paint the picture and insist that somebody listen. Thank you.